Hi everybody, my name is Missy Chamberland, MD. I'm a retired orthopedic surgeon. I've been sitting around wanting to help, and I don't feel like I can help. So this is for COVID-19. It's around the planet. It's killing who knows how many, ultimately it will. I trained at Emory University under the direction of Dr. Lamar Fleming in orthopedic surgery. I was in practice in Colorado for 25 years. I'm not a pulmonary specialist, but I did deal with patients as an intern who were suffering with cystic fibrosis, usually children, choking on the inability to clear their lungs. And I would have to go on every hour during my call nights and do this particular thing I'm about to show you every hour to clear their lungs. Sometimes I'd come back the next day and they hadn't survived. But this is a survival technique for people who can't clear their lungs well enough on their own. And you're going to find that your family might be benefited by this a great deal. I know my husband and I, we definitely have COVID-19, and we've had it for about 5 days now, and we are both getting a lot better. We never got short of breath. If you get short of breath, you need to maybe try this once or twice, and if it doesn't improve, get over to the emergency room. I'm not saying this is a cure. This is actually something that can be used to help clear your lungs so you can breathe better, so you don't become hypoxic, so you don't suffocate. That's what's happening to these folks. It's called pulmonary toilet. That's an old-fashioned name, but it's actually, that's what it is. It clears the bad stuff out of your lungs. COVID is a SARS-type disease, and the R in SARS means respiratory. So the main problem here is the lungs. So we got to figure out a way, as a humanity, in my opinion, to try to help the lungs. And that's what I'm about to show you. I'm going to take my temperature as we go here so that you know what I started at, because I know I need to do it now. The second thing is called postural drainage. I'll be leaning down. You'll see my butt will be high, my head will be low. That allows gravity to let the mucus come out easier. Make sure you start out hydrated. You have to make sure to drink a lot of water. You can't be dehydrated. And coughing makes you dehydrated because every time you cough out water. And hydration doesn't mean caffeine and alcohol, even though that may be what you want to do right now. The air sacs can be cleared if the tubes going to the air sacs are really well lubricated, so make sure you're hydrated. So here we go. So let me get it up here so y'all can see. When I started, my temperature, you see it, 99.7. 98.6 is normal. So anything above 99, you ought to be doing this. Or if you're starting to cough, have your family member do this for you, okay? This can be done for babies and adults. For adults, you'll see that the hands are cupped. And it's actually like playing a drum. It's musical. You should hear sort of a hollow sound as you're thumping. It's not done with flat hands, and it doesn't hurt, okay? With children, babies, do 3 fingers. See how that kind of makes a cup right there? And if this is the rib, same thing. You hear that? Okay. Phil's going to do it to me. I apologize. I'm probably going to cough and sound disgusting for a while. I'm going to lay over there till I kind of quit coughing, then I'm going to come back and take my temperature. Anyway, we need to do this, in my opinion. It's just my opinion, okay?
A way to help ourselves.
I hope it's a way to help you and your family and your loved ones, friends. And even those patients on ventilators, I sure hope the doctors are doing this. I'm not in the business anymore, but I sure hope they're doing these things for those folks that are critically ill and they're just suffocating on their own fluids and mucus. That's my lecture. I don't mean to offend anyone. I'm trying to help. Here we go. You're about to see my sexy husband, Phil. So you want to get a pillow or a bunch of pillows to put under yourself here so that, see, my lungs are down, okay? So he'll start. Go around to the front of the lungs and the sides, especially down on the lower ribs. You can roll to help them get to you better. If you start coughing, let them keep working that area. It's going to go to my back. That feels way better. Again, he's staying on the lower back. It's a great triceps workout for the thumper. He's the thumper, I'm the thumpy. I'm feeling really flush right now, like I'm breaking a fever. I'm like sweating all over. I wasn't sweating over there when I was talking. When you roll on your side, put that one arm up. On the front. I'm gonna move over a little bit because sometimes you gotta reposition so that the person doing it can actually mechanically get to you. If you don't have COVID and you're doing the thumping, make sure you're wearing a mask. I'm coughing a lot. I don't want to give it to my loved one. Okay. It's okay to lay here for a few minutes. I find that for about 10 minutes afterwards, I cough up a lot. And I feel like I breathe better. Whew. I don't know if you can see, but I am just sweating. So we're going to measure my temperature again.
This quick?
Yeah, I might have to wait a few minutes.
We'll
We'll see.
5 minutes.
We'll see. Wait a second. It does make me out of breath a little bit, but it's not bad. So it actually went up by 0.1. Okay, so I'm gonna come back
In 5 minutes.
in 5 minutes or 10 minutes. When I quit coughing, I'm gonna come back and do the temperature again. But every time I've done it, my temperature's gone down and I feel better for hours. I can breathe better. So,
See you in 10 minutes.
see you in 10 minutes.